This week on the Mindful Men podcast.
It was when the big personal trainer craze was kicking off, when everyone wanted to be a PT. This is in sort of back in 2008, around that time. And so I went back to university on the Gold Coast and did a Bachelor of Medical Science. And I remember sitting in the first lecture, and it was about human anatomy and physiology. It stuck with me. I'd never done science at school. I did PE and drama and all the sort of flaky subjects, I guess you could say. But yeah, this first lecture was just like, oh my God. And it just stuck in my head. And I'm just like, I love this. And I ended up like topping nearly every subject in the whole degree. I couldn't believe my brain still worked after how much I'd cooked it the few years. But it just all stuck in. And the problem was, though, my ADHD I didn't know how to harness it to study well. Like I kind of did, but I didn't. And what I mean by that was that when I would sit in lectures, I couldn't concentrate. I would fall asleep all the time. That was a problem. What I have is if I'm not concentrating or something doesn't hold my attention, I'll fall asleep. And so people used to joke that they would gauge how interesting the lecture was, how long I would stay awake. So I would go to these lectures because I'd feel bad if I missed them, but I'd just fall asleep in them. But then what I could do was I thought, right, I can go to the library and lock in or hyperfix on the topic. And that's the advantage with ADHD is if you find a topic you're interested in or something you like, your brain will just fix on it. But I learned through uni how to sort of harness that ADHD power, which is the fixation, because I could sit in the library and I could smash through a whole chapter, a med book in like an hour and a half, and it would just stay in there. And then other times I'd go there and I'd be flapping around and I couldn't get the fix. But then when I did, it would lock in. So I kind of started to learn, like, yes, I've got something that is hard to manage, but also at the same time, it's something if I can learn how to harness it, then it could be pretty special. And that's kind of, I guess, how I got through med school and did well in exams and that kind of thing. If I wasn't feeling it, I would just sort of go and do some training or distract myself for a while until I could get that fixation on it. And then bang, away I would go.
Yeah, I'm interested. How does a DJ and roofer pick that degree in the first?
Well, I guess I've always sort of been try to stay pretty fit and active. And so my thoughts were I'll go and do physio or something because the Gold Coast had just got the Titans and the Suns and the Com Games were coming up. And I thought this sporting industry is sort of what I want to do. So I didn't know whether I was going to do physio or something, but it just seemed biomedical science was kind of a good one to get as a foundation. And then because I did so well in all the subjects, the university actually said to me, with your grades, you can come into our med program. Like, you've absolutely smashed us out of the park. And I'm just like, Dr. Stewart, man. All right, sweet. so then I was into med at the age of 28. I went back into med school, and it was interesting because most of the kids there were 17, 18. And so I was the more mature, whatever the mature students that was in there. But yeah, no, I'm still a little bit immature, so I got fine with them.
Were you the mature student that fell asleep?
I still fell asleep. Yep.
So like, what's this dude doing here?
And that's what led me to get the diagnosis. I went and saw the doctor on campus, and I said, I'll get a coffee mug, and no joke, probably 5 things of coffee in there. Come on, and I slapped myself before a lecture, and I'd walk in, and I'm just like, nah, I'm out. And so I go and say to him, mate, I can't stay awake. I don't know what is going on. And then he diagnosed me with I went and did some tests and that kind of thing. And then they started me on dexamphetamine, which worked amazing. Absolutely worked amazing for my brain. You know, it's a stimulant, but for someone with ADHD, it actually slows us down. Whereas someone without ADHD, you give them and that's kind of like they're on speed kind of thing. But for me, it slowed me right down. And so it was just a bit of a game changer then. I kind of felt I was on the level playing field with everyone else who, you know, would be awake in lectures and then I would sort of be awake. But yeah, that's what sort of led to that late diagnosis. But once I got diagnosed with it and then going through med school and learning all about it and now all the stuff I know about it, it's like, oh man, I had this ages ago. But, you know, back when I was at school, you were just a disruptive child.
I was going to ask you, getting the diagnosis, did it have like any aha moments for you looking back at your life?
Yeah, definitely. Chasing a diagnosis for a condition or for something, it can be a bit dangerous. Like you can almost pigeonhole yourself. But I wasn't. I just wanted to know what the hell was going on with me. I sort of thought ADHD, but I didn't really know too much about it. It was early on in our med degree, so we weren't learning about conditions yet. We were more learning about anatomy and physiology. But then once I got the diagnosis, everything sort of just made sense of why I am the way I am. I don't know how many different jobs I've had because I'll get something, I'll like it, I'll learn how to do it really well, I'll become really good at it, and I'm like, all right, I'm bored, and I'll just change to something else. All these things kind of make sense to me now though that diagnosis of ADHD is there.
So how did that play out through your studies and then becoming a doctor?
Probably what led me to become a GP, because as a GP, every 15 minutes your subject changes because you've got a new patient coming in. So it keeps you on your toes. There is no way I could be an anaesthetist or, a radiologist. I couldn't do that. So I guess GPing stuck out to me as just a constant, because you never know what's going to come through the door. I mean, you do after a while when you get to know the names of the people. You're like, okay, come again. I shouldn't say that. But,
That's me going into my doctor. He goes, oh no, what's going on now?
Yeah, so I guess I knew that I needed a career path or something in the medical industry that was going to be changing all the time. And so that helped me choose. And that played out well in the hospital years, because hospital's a pretty ordinary environment for a junior doctor, especially if you want to get onto a pathway like surgery or something like that. You've essentially got to brown nose your way, and it's really bad. And consultants will use that, and it sucks. There'll be kids staying behind after hours doing so many notes, not paid, and the consultant will say, "Oh, you're going to stay behind?" I'm like, "No, see ya. It's over, mate. Out here, unless you want to pay me overtime. I'll see you." That kind of helped me, and being a little bit older as well, and living a life like I didn't come from a family of doctors. I had the ups and downs before I became a doctor, and that played well in my hands because people can relate to me as a doctor. They know I've gone through my shit. They know I sort of have lived that life. I'm not just someone who hasn't experienced anything. I'm just going off what the textbook says. So that kind of helped me as well, being a little bit older.
And so how does your pathway or your story lead into prescribing medicinal cannabis? Like, where does this come into it?
Yeah, so I was going to mention this before with how, I guess, drugs and all addictions work with my ADHD. Now, growing up on the Gold Coast, have a smoke, go for a surf, have some Maccas, repeat. That was kind of the weekend thing you do, or after school. And I remember, when I would connect with cannabis, it would do something to my brain. It would slow it down, and I kind of had the feeling that I'm, I guess, kind of back in the room. I'm now present in the room and the conversation. When someone with ADHD, you can often feel you can be in the room, but you're not. Like, your brain is just thinking about something totally different. You've got about 5 different topics going on, and then someone asks you a question, you're like, what are you talking about? She's like, I've been talking to you for 5 minutes. Like, oh. But I just found when I connected with cannabis, it slowed my brain down. And I just, wow, this is doing something special. So I was using it quite a bit growing up. And then, going through med school and going through College of GPs and university, I just always thought, it doesn't quite sit well with me, the amount of prescriptions and pharmaceuticals we're giving. Like, we were really taught end-stage disease, give them this. And that's the kind of medical model that is at the moment. It's wrong. It should be prevention, stop people getting to that stage, and do that through diet, exercise, plants, mindfulness, all this kind of stuff. But that's not what was taught to us in med school. It was all, someone has this, give them that. If they don't respond, give them more. If they don't respond, give them another one. And then you'll probably need to give them that because they're going to get a side effect from that. I'm just like, if I was to mention in a university, how about plants? Has anyone thought about plants? I would have been pushed out the door and burned at the stake. And in my first few years as a GP, you're essentially, and I'm not dissing P's, it's a tough job because to make a living, you've really got to pump through 15-minute consults you do. And it sucks because you're not giving good care. People are surviving and they're not thriving. And as a GP, you're just kind of holding people on the level they are. And unfortunately, a lot of people are at a pretty low level of health. And as a GP, you're kind of just keeping them there. Use your weekly, monthly pills, your blood pressure's all right, away you go kind of thing. And in 15 minutes, that's all you've really got to do. But we are just giving out scripts. And I'm like, it just didn't sit well with me. At the end of the day, I didn't feel satisfaction that I'd helped or made a change. And some days I would leave and think, I really wish I could take that person off that medication or something, but you can't a lot of the time. And then in 2016, cannabis became legal to be able to prescribe by health practitioners. And I remember thinking, I smoked a bit of weed growing up, and that worked well for me. It calmed me down. I could sleep well. And so I started following it, and then I had it organised for one of the companies to come and talk to me. There wasn't many companies on the market then. And I remember my first patient was a farmer from Outagimpi, and she couldn't sleep. And just, insomnia is terrible. If you can't sleep, it's horrible. Then the problem is you build it up in your head and you make it worse every time you go to go to bed. Anyway, she couldn't sleep. And I'd thrown every pharmaceutical at her under the planet. And now I think about it, I think that was a horrible thing to do because I could have got her addicted and all these type of things. But anyway, we'd had a crack at everything and nothing had worked. And I said, do you want to try some cannabis oil? And she's like, oh yeah, whatever you think, I'll give it a go. And I'm like, so I had to fill out the big form and it took ages. And I got her some THC oil and gave her the dosing guide. And then 2 days later, honestly, she came back into the clinic, didn't have an appointment, came through the door, hugged me, and she's like, oh, I slept 2 nights in a row. And I was like, yes. And then I'm just like, right, that's the response. I've got goosebumps now talking about that. I'm just like, that's the response I want from my patients. That's what it should be to be a doctor, to get that happiness that's it's working. And then I started learning more and more and more about it. There wasn't a lot of stuff, I was kind of one of the early adopters. There wasn't a lot of stuff out there for us to go. So I was getting a lot of things from overseas, just learning my craft. And I just slowly started prescribing more and more and more. And now I've essentially left Western medicine for 2 years. I'm still a GP, but instead of handing out a pharmaceutical, I will use cannabis to do it. And it's been a very rewarding path. And, I've got to say, it's not for everyone. So everyone listening, don't all of a sudden go out and try cannabis. You need to go through your health practitioner, and you need to go through someone that knows what they're talking about, because cannabis just isn't just cannabis. There's a lot of different things. And if you get the dose wrong, it can be an ordinary experience. So, you've got to go the right thing. But it's funny how I've been able to benefit from myself. And now I'm in a very fortunate position where I can now spread it on and pass it to a lot more people.